Hello, my name is Tristan Adams, and I'm presenting on influenza. Influenza is commonly known as the flu. It's a highly contagious viral infection, and it causes infection to the respiratory system. It affects mostly your nose, throat, lungs, and even can cause a fever or body aches, and in extreme cases, cause extreme exhaustion. There are also three different kinds of influenza virus, known as influenza A, B, C, or also known as flu A, flu B, or flu C. The onset of influenza usually appears as a few initial symptoms. These symptoms include fever, headaches, chills, loss of appetite, muscle aches, and even a cough. There are also some other symptoms that can be accompanied along with the flu. These go along with nausea, diarrhea, and even vomiting. These are in much more extreme cases of the flu in people that are much more sick than others. These symptoms are also much more common in children, as adults don't usually get nausea and diarrhea or even vomiting when they contract the flu. A lot of symptoms kind of go hand in hand with what is known as the common cold. So it is easily not so easily distinguished sometimes when you have a very mild case of the flu. When it becomes of more severity, though, the flu is more recognizable. Luckily, we have a flu test that is able to tell us if you are infected with the flu, and we can even differentiate between flu A, B, and C. So, and to go on that, for an example, fever and headaches are very uncommon for a cold. And so when you get some certain symptoms, it can kind of distinguish between the cold and the flu a little bit better. But as we keep going on, stuffy nose and sneezing, along with a sore throat, are common between a cold and the flu as well. So sometimes it's more hard to distinguish between the flu and the cold, but a simple test can help differentiate that. So going on, influenza virus is the leading cause of respiratory viral infections worldwide. Up until 2018, we kept seeing more and more severe flu seasons each year, each getting worse with more adaptation to the flu virus by changing its genome sequencing and allowing it to attach onto our cells through different proteins. In the start of 2019 and 2020, and now even in 2021, we've seen a decline in the influenza virus that has been taking place by a virus that we all know as COVID-19. In the past, between 2000 and the year 2018, the average number of influenza deaths in the United States was around 40,000, and that grew slightly every year but stayed proportional based off the population and the percentage. So going off some of the information in the slides before, some of the symptoms even between a common cold and the flu are the same. They still differ enough for a doctor to be able to make a medical diagnosis even without a test. If you feel like you're experiencing flu symptoms, it's important that you go seek medical help, as the flu can drastically take a turn for the worse and your symptoms can be exacerbated without treatment. And if they aren't able to diagnose you based off your symptoms, a quick nasal swab is able to test for the virus with a 15-minute test, and then a clinical provider will be more able to test you and diagnose you. So, treatment for the influenza virus varies drastically. Depending on your symptoms, that can change the treatment that you receive. If you are experiencing exhaustion, body aches that come with the flu, most likely treatment will involve rest and drinking plenty of fluids and electrolytes. Medications such as antivirals or even cough suppressants and NSAIDs, including ibuprofen, are usually advised to help keep down the inflammation inside the body and allow the body to naturally heal. In some cases, a vaccine can be recommended for people that aren't infected by common flu symptom from year to year, since vaccinations are the main preventative from contracting the flu. Proper hand washing and even masking has proven over the years to lower the chances of contracting the flu and even eradicating it in some hospitals that practice studies of masking. Covering for coughs and sneezes obvious and keeping common surfaces cleaned allow for the stopping the spread of the flu as well. And I use 5 different references from anywhere from the CDC to the Mayo Clinic to Georgia State University to help back my arguments and my information provided in this PowerPoint. And here's a cool little model of the flu virus that I found online. Thank you. Have a good one. Bye bye.